Sharing Christ, sharing life, Blessed Hope Broadcasting Services.
Good evening, brethren. This is the third and the final health talk for our annual Believers Convention at Blessed Hope Seventh-day Adventists in 2024. Today, we are going to talk about the remaining vitamins, which is D, E, and K. I'll first of all start with vitamin D. Vitamin D is also a fat-soluble vitamin, that is, it dissolves in fat, responsible for the increase in intestinal absorption of calcium, magnesium, and phosphates. The most important group of the vitamin D in humans is cholecalciferol, that is D3, and egocalciferol. Cholecalciferol is synthesized in the lower layer of the epidermis of the skin through a photochemical reaction from sun exposure or ultraviolet B lamps. It can be synthesized in adequate amount by most mammals if they get adequate sunlight. It is recommended that vitamin D is taken by mouth because of sun exposure in population that is variable. And sun exposure is also uncertain due to associated risk of skin cancer. What do I mean by that? For in cases where the weather or the climate the sunshine is inadequate, we are recommended to take vitamin D supplements. And unfortunately, some places are quite sunny, but people might not want to be exposed to too much sun exposure because of the risk of skin cancer. What are benefits of vitamin D? It helps in the regulation of calcium and phosphate for the promotion of healthy growth and remodeling of the bone. When you don't have enough vitamin C, calcium and phosphate cannot be thoroughly utilized to help in having a healthy bone. It helps with cell growth, neuromuscular, immune, and also prevents inflammation. It helps in calcium metabolism, preventing rickets in children. Rickets is a childhood form of osteomalacia. It also reduces susceptibility to some types of cancer. Deficiency of vitamin C. Rickets in children is the softening and weakening of growing bones due to nutritional deficiency of vitamin D. In adults, it can result in bone damage and bone mineralization to bone softening disease. It is associated with increased risk of developing some types of cancer, namely melanoma. Dark skin population living in temperate climates are known to have low vitamin D levels due to the melanin in the skin, which hinders the synthesis of vitamin D, common in Hispanic and Afro Americans in the UK and also in USA. With significant deficiency in the winter months, that is, dark-skinned people, because we come from mostly very hot countries, our dark skin is meant to protect us from the scorching sunlight. But unfortunately, when we live in cold climates, the little amount of sunshine is also not adequate for us, and we are not getting enough of it because of the melanin, because of our dark skin. So we end up becoming vitamin D deficient. It is also recommended by clinicians that the darker you are in a temperate country or in a cold country, then the more you need vitamin D to be able to not to have a deficiency of vitamin D. In countries where dietary deficiency of vitamin D is common, diet is fortified with vitamin D. We have diets like biscuits and bread that are fortified with vitamin D so that people can have adequate vitamin D. Osteomalacia and osteoporosis is a disease in adults as a result of vitamin D deficiency. Softening of the bones leading to bending of the spine, proximal muscle weakness, bone fragility, and increased risk fractures. Osteomalacia reduces calcium absorption and increased calcium loss, from the bone, which increase the risk of bone fractures. The effects of osteomalacia also result in chronic musculoskeletal pain. What are sources of vitamin D? Fatty fish, as in salmon, cow's milk, breakfast cereal, mushroom. Vitamin E is a group of 8 soluble compounds that include 4 tocopherols and 4 tocotrienols. Vitamin E is rare. Deficiency is very rare. It is usually due to an underlying problem with digesting dietary fats. That is, people rarely have vitamin E deficiency. When people have vitamin D deficiency, it's not that they are not having enough vitamin E sources. It is because they are having problems, internal problems, that does not allow them to digest fat. Of course, if fat is not digested, then you are not getting enough vitamin E. People who consume vitamin E dietary supplements have low incidence of cardiovascular disease, cancer, dementia, peripheral neuropathy, myopathy, retinopathy, and impaired immune system. What are sources of vitamin E? Wheat germ oil, palm oil, olives, grapeseed oil, soya beans, margarine, almond butter, hazelnuts, sunflower, almond oil, pistachio nuts, avocado, spinach, and raw cashew nuts. Food sources are brown rice, pasta, potato, fish, eggs, oysters, cheese, chicken, and beef. Consumption of vitamin E in excess of 300 milligrams daily may also interact with drugs like aspirin, which is an antiplatelet drug, warfarin, which is an anticoagulant, and cyclosporin, which is an anti-rejection drug. Vitamin E should not be used by individuals receiving cancer treatments or radiation therapy and some types of chemotherapy, because it can counteract their effects on treating the cancer. Vitamin K. Vitamin K is another fat-soluble vitamin found in foods and marketed as dietary supplements. It is made by plants and is found in green leafy vegetables. Benefits. Vitamin K is useful for the production of blood clotting protein. It is used in managing anticoagulant therapy in clinical area where patients are on anticoagulant therapy like warfarin, and their coagulation time, or their what we call INR, is deranged. We use vitamin K as a supplement to reverse this so that we can perform surgery on them, so that the blood will be the normal clotting limit so as to avoid bleeding during surgery. It also prevents osteoporosis. It helps to maintain the arterial elasticity. That is, it prevents the arteries from calcifying and not having elastic to pump blood around the body. What are deficiencies of vitamin K? It can calcify arteries and other soft tissue. It can result in uncontrolled bleeding because of the inability of the blood to clot. What are sources of vitamin K? Green leafy vegetables, poultry, Chinese cabbage, blueberries, pears, whole wheat bread, Brussels sprouts, kale, baked sweet potato, kiwi food. Note: vitamin K is uncommon in healthy adults and children. An exception is made in infants who have poor transfer of the vitamin from the mother via the placenta and low amounts in breast milk. God bless you.
Sharing Christ, sharing life, Blessed Hope Broadcasting Services.